Why children's immunity is more resistant to coronavirus. Even in the early months of the COVID-19 pandemic, it became clear that the new infection was bypassing children for reasons that were unclear at the time. And if children or adolescents are infected, they have a markedly milder course of disease than adults. The situation has not changed much even today, almost 2 years after the start of the epidemic. Nevertheless, experts already have some theories explaining the phenomenon of higher resistance of children's bodies to SARS-CoV-2. Back in 2003, when the SARS outbreak occurred, doctors saw about the same situation as now with SARS-CoV-2. Back then, the infection also barely affected children. Children younger than 12 years of age were the least vulnerable during the epidemic. Although almost 800 adults died then, which is about 10% of all those infected. Back then, experts didn't have many theories as to why children got sick differently. Today there are several. Strong innate immunity. Recently, US scientists have also begun to talk about how children may be protected from the coronavirus by strong innate immunity. In particular, experts found powerful immune cells on the mucous membranes lining the nose and other parts of the body that come into contact with germs. Mucous membranes are made up of epithelial cells, dendritic cells and macrophages, which are key elements of the immune system. These cells are coated with special proteins known as recognition receptors. When they detect a pathogen in the body, they send specific impulses to the cells. As a result, the body begins to produce the protein substance interferon, which determines the immune response. 1. In another study, experts at the Berlin Institute of Public Health in Germany found that the upper respiratory tracts of children are pre-activated to resist the new coronavirus. There are many immune clients in the respiratory tract that perfectly recognize the causative agent. According to the researchers, this feature allows boys and girls to instantly activate their innate immunity to produce interferons that stop the spread of the virus. In adults, there are far fewer of these cells. It takes about 2 days for the adult body to recognize the virus and react to its entry. And by that time, the pathogen has time to multiply a lot, and then it becomes harder to fight it. These findings suggested that children do not need as many antibodies to resist the virus as adults. In young bodies, the immune cells of mucous membranes are good at this task. Scientific studies show that healthy boys and girls have a large number of lymphoid cells, immune system cells, which, if infected with the coronavirus, make it easier to resist the disease. The number of these cells decreases with age. 3. Another possible reason why children are less susceptible to coronavirus is the ACE2 receptor. More precisely, the number of these receptors in the body. SARS-CoV-2 virus enters the human body by airborne droplets. Getting on the mucous membranes of the nasopharynx, the pathogen binds to specific ACE2 receptors, after which the virus multiplies and spreads throughout the body. Now, studies have shown that children have fewer ACE2 receptors than adults, which means the risk of the virus taking root and multiplying is lower. The fact that children's bodies adapt more easily to new diseases than adults is nothing new in scientific circles. That is why many diseases, such as chickenpox or measles, are easily tolerated by children, while in adults a similar infection can cause serious complications. It may well be that something similar is happening with COVID-19. Children's bodies have adapted to their new environment and are more resistant to the pathogen.